It's a proud day when a nurse receives her cap. Gone are the days of the starchy pressed white dress, white stockings and shoes, and the nurse's cap. While the cap is no longer worn while on duty, many nursing schools still award graduates the cap as a completion of the nursing program and the transition to the workforce. The tradition of the nurses covering hair is over 1,000 years old. The awarding of a cap is believed to have begun in the mid-1800s by the Sisters of Charity of St. Vincent de Paul in Paris. Many of us remember our uniformed school nurses giving us immunizations for such long-ago childhood diseases as measles and polio. But the role of school nurse has changed over the years. Today, DSUSD Health Services team is responsible for the health needs of over 26,000 students and 2,700 members of staff. They monitor worldwide and local health issues, including COVID, and work closely with the Riverside County Health Department. Whether it is the coronavirus situation of today or the measles of just a few years ago, it is our health services team that leads the way. The health services team is part of the Student Services Division under Assistant Superintendent Laura Fisher. Lead nurse, Susan Cadle, and the 10 credentialed school nurses, 9 licensed vocational nurses, and 5 special education health techs make up the team. The credentialed team of nurses creates health management plans for our students, including those that could be needed in emergency situations. They administer physician-prescribed medication to our students, such as insulin and anti-seizure meds. They were at the forefront of coordinating COVID immunizations and testing with county and local authorities. They became the task force responsible to follow up with staff and students throughout the crisis. They ensure the staff have up-to-date TB testing. As a team, they provide basic first aid and so much more. They follow up with students whose required immunizations are not up to date and provide hearing and vision testing as needed. From presenting a student with a special tooth box to preserve the tooth they lost at lunch, to assisting families with finding medical providers, each member of the team puts the needs of the students first. Some of the more medically fragile students require urinary catheterization procedures, while some require tube feeding or colostomy attention. Over 50 DSUSD students are seen daily for over 70 procedures, with many of these students requiring assistance multiple times each day. Annually, the team complete over 8,500 hearing screenings and 6,500 vision screenings. They've also trained over 300 staff members in caring for our students with medical diagnoses that may need care at school, including training for emergency anti-seizure medication, epinephrine autoinjectors, diabetes, and Narcan. Over 1,500 health assessments for students with IEPs are conducted annually. 24 individual healthcare professionals, each with a story to tell on why the role of school nurse called to them. Desert Sands Unified School District thanks each one of the men and women who take such wonderful care of our students.
So as a health tech, what we do in our department, we usually do catheters, we do colostomy bags, we do G-tubes, we do suctioning, we do breathing treatments, we administrate medication, and we're also there in case of any emergencies.
COVID it changed school nursing in a way because remember, for the first part we didn't even have students on our school campuses, but we were contacting our families, some of our special needs students, to see did they need resources, did they have everything they needed, and then all of the surveillance and tracking and tracing that went with that really did come back a lot on the school nurses.
Definitely not just sitting in the health office and handing out Band-Aids and ice packs. There's a lot more that we have to deal with. There are immunizations that we have to check at the beginning of the year, constant head bump reports when students do come in. We do have to do catheterizations. We have to manage colostomy care, diabetic care.
I was inspired to become a nurse when I had my son years ago. He's actually a DSUSD student now. He was born premature, and during his time in the NICU, I was able to witness the impact that nurses had on children and their families, and I wanted to provide that for families as well.
We are the medical professionals for Desert Sands School District. While the work can be challenging, it is also very rewarding.